Malnutrition usually is an issue that is unrecognized as a condition that needs treatment in the communities. So usually we find that caregivers think the signs of thin arms, bulging stomachs, pallor in the skin, different things that you will see. That the child is not looking well. They think they are signs of a child growing up and they're normal. But from the studies that ACF and partners, especially UNICEF, have championed, we have found out that this is not true. And the communities need the correct information to be able to make sure that the children's nutritional status are definitely improved.
The community has a level of recorded some malnourished children. Well, they were lagging behind in terms of having adequate nutritional feed ranking from the mother breastfeeding, and some also might have due to the economic hardship of the parents.
When I saw that my child started losing weight and having big tummy, I knew he had malnutrition because I heard it on the radio. So I brought him to the clinic.
My child was vomiting and losing weight. I did not know what was wrong with her. Then a social mobilizer came to our house and asked me to bring her to the clinic. I told my husband and he brought me to the clinic.
CMAM is a campaign on community management for acute malnutrition, and it's geared at empowering community members with skills, with the adequate knowledge that they can use to make sure their children are not malnourished.
One of the most important aspects during the intervention is the continuous education that is planned within the program, and even the food that is being supplied, that is the food that is prepared for children with that kind of menace, have seriously assist in the prevention, control, and the treatment of malnutrition among children.
For these different groups, we've been able to come together with other stakeholders to define clear-cut messages. What do you want them to do? And what knowledge do they need to have to be able to carry out these things? So for caregivers, is to even recognize what the signs of malnutrition are and to know what to do, where to go, and what to expect when they get to these places. So for instance, one very critical information we have shared, which we all love, is that the services are free. And this has been made possible by the support of the government of Sokoto State and all other partners supporting them.
We are able to then engage an NGO that is on ground in Sokoto State, HCOMD. And through them, we were able to also recruit a lot of community volunteers that we were supposed to use on the field. Some of the things that we do on the field include community dialogues, where we bring together members of the community, dialogue with them, discuss issues of malnutrition, and then ask or tell them what to do in case they notice signs of malnutrition. We also conduct house-to-house visits. These are done by all the community volunteers. The role of the community volunteer is to, within their own catchment area, go out, identify children that have or that are manifesting the signs of malnutrition, relate and engage with their mothers or the caregivers so that they can take them to the health facilities.
As a community volunteer, we are a group. We have to work along with my teammates. So the ladies have to walk house to house. We, the men, we normally announce it maybe when we sit with friends like this. We inform them. Maybe if we are in the mosques, we inform them. Maybe if we see anybody with something severe to malnutrition, we ask for the parents. If the father is nearby, we introduce ourselves to him and tell him something about malnutrition. Then he may give us go ahead that yes, we shall assess the daughter or the son. Then they will refer it to the hospital.
One of the things that we did also was to make sure that we had radio spots. About 5 of them, they are airing on Rima Radio right now. And then we also have radio magazine program. That's a 15-minute radio magazine, interactive radio magazine program that details, the effort of community volunteers on the field, wherever they go.
Before, we were not informed, but as a result of the CMAM communication activities, that is what broadened our knowledge and capacity to be able to speedily shape the opinion influencing decision. That is for educating family, for educating community, that for the overall well-being of children and mothers in the community.
So all the caregiver needs to do is take the child, get out of their comfort zone, forget all stigma relating to what the child looks like and what they expect or what cultural beliefs they have, and go to the health facility where they will be treated free of charge.
CMAM is a program that impacts the life of the common man in the grassroots. The CMAM program brought about plenty of philanthropy, manufactured nutritious food given to malnourished children. This has greatly improved the situation, living condition of malnourished children. It's a very rapid response to malnutrition treatment commodities that we have. We appreciate it, and it's well working very well. You will see within shortest period of time, the communication of activities within the community has reached out many across the community and across the state entirely. So you see down the people, before, people has a negative perception, thinking that this plant peanut is made of something there. But now as they made to know that it is clean and very safety, and it is also nutritious, as they recognize, they understand this, they now involve into demand. Demand for this commodity is very high everywhere.
We have a very good case study of a child that we came across in the community, and we're encouraged to go to the health center. You will not believe the child was actually a 2-year-old girl, looked like an infant of 6 months, severely malnourished, and through the efforts of the campaign team, we were able to coax the parents, encourage them to take the child to the center, and we have her picture as one of the materials today as a success story. And when we came across her the first time, she could barely sit up. She talked less of stand, and she was just fretting, crying all the time. But in 6-8 weeks, we were also actually amazed personally, and we were very blessed with the results we got, just because the caregiver took the child to the center and abided by the guidelines that the health worker asked them to do.
I did not know my daughter was suffering from malnutrition. She was very sick. I was very worried. Then someone told me to take her to the clinic, and I did.
I think this country is going to lose a lot if it doesn't take care of the children it has now, and because everybody knows this saying that children today are the leaders of tomorrow. But if the government of Nigeria can take this up on a full scale and look at children around all the states, not just concentrate on a particular zone, because as I said, it's everywhere. It's just that in some states it's more intense than you find it in others. So if the government of Nigeria can take this as a personal passion, personally I think Nigeria will be a better place.
Thank you very much. My daughter is alive today because of this CMAM treatment. Thank you very much.